All right. So it's 3 p.m. for us in Central Europe. So we can go ahead and start this webinar. So good morning, good afternoon, or good evening, depending where you are joining us today. And thank you for taking the time to attend this webinar. This webinar is organized as a series that we started a couple of years ago called Knowledge Dissemination Dialogues on AMR. So today it's my pleasure to moderate it and to host and welcome a colleague here from Rome, from the headquarters, Francesca Latronico, that will be speaking with us about fostering the generation of scientific-based evidence to address AMR at One Health interfaces. So like I said, Francesca works with me just across the hallway in Rome at the headquarters and the different divisions. She's a veterinarian originally from Italy with several interesting international experiences. And she's coordinating a lot of our work that we do on AMR regarding research and laboratories. So she will be presenting some of that work and others that she's working on. Just a couple of housekeeping rules. Please keep your microphone on mute. Rename yourself with the organization country followed by your name. Some of the views presented by Francesca today might not be necessarily the official FAO ones, but her own. Please refrain from advertising your services, your company, or any other commercial products or brands. And please post your questions here in the chat. We'll aim to answer all questions during the discussion at the end of the presentation. And if not, we follow up by email. Please keep in mind that this meeting is being recorded, and the video recording and the PowerPoint slides that Francesca will present will be posted on the FAO YouTube channel and shared with today's participants. So don't worry about that, but keep in mind that the recording will be shared online in our social media. So I'll stop here, Francesca. The floor is yours, and thank you for your presentation.
Thank you very much, Jorge, and welcome everyone. So just a few seconds that I need to put up my screen. Can you please confirm that you can see it?
It's coming. We can see it, just it's not yet in slideshow. Yes, there you are. Now it's good.
Okay.
Thank you.
Yes. So thank you very much. So as I always say, well, welcome everyone. So it's really a pleasure for me, to share the update about how we are actually fostering the generation of, well, evidence. So supporting research to address AMR, especially at One Health interfaces, but also at the sectoral level. As Jorge would say, that as a background, I'm a veterinarian, public health microbiologist, and I've been working now for more than 5 years in FAO at headquarters, but also supporting, different countries around the world, as we are at the global level supporting the region and the countries. So those are basically what I'm going to touch upon. So just a few slides to remind us why it is important to address AMR, but more information regarding what it is the status of the research fund allocation, scientific publication that it is out there, and then more focusing on one of the activity that we have done to support for One Health research activity across the sector, and then what we are actually doing for supporting the network. So first of all, as I was saying, let's remind ourselves so why we are actually working on antimicrobial resistance and why we are actually working also on across the different sectors. We know that it is a global health, development, and economic concern. The first document that actually has given a push for all the different activity and supporting, also providing some funds, was a report which was published in 2016 from Jim O'Neill. And in this report, the estimate was that if nothing is done by 2050, every year, 10 million people can die of antimicrobial resistance. These will actually put forward the idea that AMR will become the most important reason for death, in human death, surpassing also causes for the high income countries, for example, surpassing the number for cancers, but also road accident, and also in low and middle income countries, as for example, more than diarrheal diseases, cholera, and diabetes. Badly enough, it is that based on the information that we have now available, especially because during these last 10 years, a lot has been done to improve the capacity to detect antimicrobial resistance through capacity building for laboratory and surveillance. The number that were predicted in 2016 are actually might become a reality. So in the latest publication, which was like the global burden of bacterial antimicrobial resistance as a systematic analysis, the forecast, they estimated that in 2021, there were like more than 4 million people dying associated to bacterial antimicrobial resistance, and including 1.14 million death attributable to bacterial AMR. And based on this number, the forecast for 2050, it is very close to the one that was predicted. So like an estimation of 1.9 million death attributable to AMR and 8.2 million death associated to AMR would occur globally. And well, I've been very fast in going through the map, but there is also a huge difference between, like, of course, the country that will be affected the most. Now, if we consider like the importance for the other different sector, first of all, we know that one of the main driver for developing of antimicrobial resistance, it is the use of antimicrobials. And actually, because they give the pressure, like in the environmental pressure, like wherever they are, for the emergence and the spread. For this reason, as you can see, like this is a very like, I think that the one of the figure that it is used most widely still. So the distribution, the red dot are the distribution of the antimicrobials in the different compartment. You can see that this one, I mean, considering the distribution, the emergence can actually happen in each of the sector and easily spread to the others. So basically, there is no place where to hide, but also we can assume that all the different sectors are impacted. In fact, we usually talk about of the impact of the human health, the animal health, and now also is becoming more important also for the plant health. And overall, it has, of course, also an impact on the pollution on the environment. If we consider like the key factor for food and agriculture, at the moment we do not have so many data, or like not so broadly like globally for the impact of antimicrobial resistance for animal health, for example, or for plant health. We are actually working also in FAO like on getting this data available through one of the systems that has been put in place, which is the InFarm. However, we are having like more information regarding the antibiotic that they are used. So we know that antimicrobials have been used for decades in agriculture, so like more than 70%. And based on the current trend, if they continue, it is considering the increase also of the livestock and the use of antibiotics in this sector, this is projected to rise up to around 30% by 2040. However, and this is numbers for a research publication that comes also from our team in FAO, it is possible to have, I mean, it will be possible also to have a reduction. When it comes to the importance and then the research, so why, I mean, research has always been considered within the picture, like on how to address antimicrobial resistance. So the first reference for research has been in the Global Action Plan for on antimicrobial resistance. This is a document that was published in 2015, and you can see that in the one of the 5 objectives, actually the second one, clearly like the country, but also the proposal was to strengthen the evidence base through research. However, I think that in the one that have been already working in this field, we know that research has also actually supported through like different research studies, like to inform policy, but also to inform practices, the other 4 different objectives. So we do have a lot of studies have been done, for example, for behavioral science, on how to better like change the behavior. So to foster better behavior, but also a lot of different study to understand the economic cost. So research has a specific like spot in the Global Action Plan, but in general, it has supported all of them, and it is still supporting. I think that this is something important to remember. This is actually the same also for like the FAO Action Plan on AMR. We do have a specific objective, which is Objective 2, which clearly identify research as a topic, as a pillar to be strengthened. When it comes to the now considering what it is the exact fund allocation that the information that we have so far, and then the scientific publication that are out there, especially considering like the different sector. So at the moment, the best information regarding Jorge, George, can you please tell me like whether I'm sharing the presentation mode? Just to be
Yes,
sure.
it's fine. Yeah,
Okay.
it's fine.
Okay.
It's investment in AMR.
Uh,
Yes.
yeah, sorry for that, but I've seen something strange. So the best information that you can get regarding the funds that have been allocated and invested, it is in the Global AMR Research and Development Hub. So they do have in their website some dashboard in which you can actually play in order to get also more tailored, detailed information. So here I actually took like a recent screenshot. And we can see that so far, since 2017, so when the hub was established, the total amount of investment has been around more than 16 USD billion. The number of projects has been quite a lot, around like 20,000, with like not so many funders, but still quite a lot. And if we consider like more specifically the investment, the breakdown of the investment for the different sector, there is a huge difference. I mean, you can imagine that the majority of the funds, so in this case, is reported around 14.5 million. They go billion go basically to the human sector. I mean, focus on research for the human health sector, followed by the animal health, the environment, and the plant. While for the cross-sectoral research, this is much lower, although this is actually increasing. You can also see in this dashboard what are the specific area and then also the infection agent. If we consider more in details the information regarding like the cross-sectoral investment, well, we know that the majority of the research, it is actually focusing on supporting operational research, capacity building, but also basic research. And this is like a bit different if you consider the overall amount of money. However, like I mean, we can there has been like an increase of funds also ongoing on cross-sectoral research. In a recent publication, which was actually from last year, if we consider like the different research, I mean, antimicrobial resistance scientific publication that they are available. So these researchers actually, they look at the number of publications through the years, starting from 2003, so in the last 20 years, more or less. As you can see for the graph on your left, there has been a huge increase of publication. Nowadays, it's around like more than 20,000 publications that they are on antimicrobial resistance every year. So this has been like quite I mean, researchers have started to work quite deeply and a lot on the topic. There is as you can see, like instead in the graph on the right, a huge differences considering like the number of publications coming from countries on a different level of income. Of course, there is a lot of publication coming from the high income countries also, because this is like a cumulative information through the last 20 years. However, if you look at the publication, you will see that it has been in a change, like also in the number of publications coming from low and middle income countries, but also for the upper medium. And if we consider, like always from this publication, the topic of the research and the different, I mean, whether there is the connection. Well, there is the majority of the research is still only toward like the majority toward the human health, but it has been an increase also for other sectors. So here the color represent the human health, the animal health, plant health, food system, and environment. So you can see that, I mean, the big bubble, it is the one of the human health, but the other one are, I mean, there are some dot at least and some links. Now, considering like what it is, I mean, one of the support that the organization, so FAO, together also with the other quadripartite organization, so the Environment Program, and then the UN Environment Program, the World Health Organization, the World Organization for Animal Health, we have supported in developing a prioritization of research activity, research areas, and this is actually called the One Health Priority Research Agenda for Antimicrobial Resistance. We also call it in acronyms AMR, OPRA. Defining this document has been, it has taken some years, but it was long overdue, and actually came to life in 2023. So there was a mention, as I was saying at the beginning, the research already in the Global Action Plan, but also there is a clear, there are different statements in the IACG, so Interagency Coordination Group of Antimicrobial Resistance, the report that went out in 2019, but also in the quadripartite strategic framework and in One Health Joint Plan of Action. So this document, so the research agenda, it is now available since 2023 in English, but since last year also in French and Spanish. This is really to ensure, like, to broadly have the dissemination, the pickup from researchers. What actually it is. So this document is a final product of a global exercise which involved a wider scientific community focused on antimicrobial resistance and at the interfaces among One Health sector. The aim of the exercise was to identify prioritized research areas at the interfaces that could inform and provide evidence to policy and practices for the countries. So in the majority of the case, it is really like having something that can support action. So quite, can be actionable. Catalyze interest among researchers and donors on One Health antimicrobial resistance, and then provide direction for investment, especially for the low and middle income countries, because when there is like funds, allocation is very low. Of course, you need to have a kind of prioritization, so you cannot invest for everything. And because this was focusing on the One Health interfaces, out of scope was the research and development of new antibiotics, antimicrobial cell vaccine, diagnostic development, and also if there was research related to only one sector. This document, it is now also part of the declaration, the UN political declaration of the high-level meeting of last year. It is actually in the commitment 93, where it is suggested that like a country committed to develop research strategies and innovation programs and integrate them within their national action plan, taking into consideration like document that has been already developed as exactly the quadripartite One Health Pride Research Agenda for AMR. So it is like clearly stated, and this could be used by countries, but also researchers to develop the proposal. The methodology. So considering like the different step in the process, the One Health Pride Research Agenda focus of 5 different pillars. Those are transmission, integrated surveillance, intervention, behavioral and insight and change, and economics and policy. We also had some other cross-cutting as a gender, vulnerable population, and sustainability that were taken into consideration for all across the different pillars. The process for developing this took quite some years. So basically, the process started in 2020 with an academic scoping review. It was also broadly done and very inclusive, as the information were put forward also for a global survey, which was open and online, and people could access freely. And indeed, we actually had more than 1,600 participants contributing. It also included information regarding gray literature review and survey analysis, and after a consolidation of all the different information from the survey, the literature review, and the academic scope review, there were selected experts which were invited through a Delphi process, also through an expert knowledge and elicitation exercise to prioritize and better refine these research areas. We also had a consolidation with expert discussion of result, and at the end the publication. We also have engaged so far since 2023 on the dissemination of the document, and we are trying to also to raise funds to support for research activities. As going a bit more into details, at the end of the consolidation, we had 154 research questions across the pillar, which were generated and then were submitted for the Delphi process. These 89 experts were selected because having expertise on the One Health and antimicrobial resistance, and also relevant for the scientific pillar that they are actually in the research agenda. We were mindful on having a global representation and also gender balance. The Delphi process, for the one that they are not aware, so this is usually used for expert knowledge elicitation, and it is a method that can is an accepted technique that make possible to establish expert consensus on a given topic. There is a threshold for which the agreement it is reached, and it is also done in an anonymous way. So people cannot be biased through a conversation because they will do the exercise alone. The specific questions that we use to prioritize were actually 5. We were asking the expert whether they thought that the research was important, so the research topic was important, whether it was inclusive, if it could be actionable in a low and resource setting, and then whether it was impactful and could also strengthen research capacity across the sector. The result at the end, we have 62 research priority areas. The number differ between the pillars, so between 10 and 15. And you can see also that the number is higher, especially for the one which are new research areas. So for example, behavioral insight change, it is the one that has the highest number of research areas. Giving some information, but please also check the document for all the different research areas that I've identified. In the process of the consolidation with the expert, we also tried to give a guidance for researchers through the categorization of the different within the different pillars. For the priority research areas on transmission, these were divided in 3 different categories. So methodology development, operational research, dynamics and drivers. So you can see in bracket what are actually the number of research areas. And to give some example, for the transmission, in the methodology development, the research areas focus on basically identify, quantify sources and drivers, development and circulation of AMR between the One Health sector. The other one focus mainly on having methods and metadata for describing and predicting antimicrobial resistant transmission. I just took some of them for each of the pillars just to give you an idea, and I hope that some of them will resonate to you and also could be put forward for your future research. The one on integrated surveillance, these actually has 11 research areas. They are also divided in methodology development, operational research, and evaluation. And for this one, the one that I selected, they consider how can the limited availability of data from integrated multi-sector AMR surveillance programs be addressed in low and middle income countries, and also how can the result of the integrated surveillance be used in practice by countries and region. So this is actually integrated surveillance is a focus for a lot of activities, so countries are investing in this, but there is still, although there is a lot of discussion and countries are trying, are putting in place integrated surveillance, there is a lot of question mark on how this result could be integrated. So we do have information that there is a need of harmonization, but how actually this result could benefit all the different sectors, this could be actually explored a bit more. For the intervention, in this case, we have 13 research areas presented in 4 categories. Always the methodology development, the operational research, evaluation of framework of condition. And for this, I selected the one for the evaluation. So, for example, what are the challenges that exist to the systematic collection and analysis of data, risk assessment and intervention, impact assessment for the low and middle income countries, and what are actually the most impactful intervention to prevent, control, and mitigate. So this is really like to provide like guidance on like what if someone has really like low resource, what could be the intervention to do. And of course, research can provide this information since like it's research study can easily support providing evidence. For the behavioral insight change, as I was saying, that this is the one that has more research areas identified. Those are 15, and they are differentiated between methodologies, development, operational research, dynamics and drivers, and evaluation. And within this, for operational research, for example, one of the questions regards like what are the barriers or the drivers to translating behavioral insight and change findings into the policy and implementation in the different settings. But also which are the actor and which of their behavior are believed to contribute the most for the prevention, control, and response across the One Health sector. For the economics and policy pillar, this is actually the last one. There are 10 research areas identified, 5 under methodology, 3 under operational research, and 2 under evaluation. And for the one under evaluation, focusing on what are actually understanding what are the lessons and the synergies for AMR reduction that can be learned and leveraged for other policy initiative to tackle collective action problems, and also how should government incentivize and drive materials and immaterials innovation, especially when the profit motive is not currently, sufficient. Coming now instead what we are actually doing to foster, to support the sectoral and cross-sectoral research networks. So at the moment, we do have also as a quadripartite the AMR multi-stakeholder partnership platform. This is a platform that has been established to promote a shared vision for AMR, but also for information sharing and networking. And within this partnership platform, there are different clusters. Among these, there is one cluster which is really including academic and research institution only, and this is actually one of the biggest clusters. So the cluster, they work through, they actually meet on a regular basis. They have been also quite instrumental to provide policy brief for the UN General Assembly last year. So there is a lot of possibility, like on a regular basis, to interact and then to reach out to, to actually discuss, but also like to establish collaboration activities. They are also like involved the different cluster in action groups. So those are actually project that the different cluster write together. So like they combine and they are on a specific topic. At the moment, I think that there are around 13 that they are going on. Another activity that for us is important and also embedded like the research component, it is one of the FAO initiative. This is the reduce the need for antimicrobials on farm for sustainable agri-food system transformation. This is a flagship initiative that was started in 2023. As the name said, it is aimed to reduce the use of antimicrobials in the farms. It has a different target, aiming at, to support like the food and agriculture sector. When it comes to the support that it is given, this is given through like at the farm production, but of course along the all chain value chain for the production of the food. Include 5 different goods, as we say, but they are focusing on improving health services, providing incentives, connection, alternatives, and practice. And you can clearly see it that, for example, for the good connection, the research it is quite important also for supporting, but also on how at the moment, we are exploring a lot on the good alternatives. and how to improve in general production practices. Within the Reno Farm, we do have also Action Accelerator, and among there are actually 5, and among these there is one which is on research, innovation, and new technologies. And this is really aiming to have to foster the knowledge generation, the new discoveries, and development of a solution. It's focusing on improving like the knowledge, but also like as I say, like to foster connection between researchers for advance in sustainable production practices. We also have the community of practice for antimicrobial resistance laboratory innovators, which is within the One Health Knowledge Nexus. And this is really to support for the, more people for the laboratory side, mainly to for sharing, for harmonizing like the practices, but also to foster like ideas, especially for example, if you consider the diagnostic, which is limited. This is of course like toward like more sectoral research. Now coming on the summary and the conclusion. So first of all, just to remind that, well, we are using One Health approach because the emergence of AMR can happen in each sector and spread easily to the others. There is still a lot of need for research across the sectors, but also at the specific sector. There is the document that has been, there are document available out there, like for example, as the One Health Priority Research Agenda, and this could be used to develop a research initiative within like the country, but also at the regional level, and also to inspire researchers on now like the topic that could be put forward for their specific studies. And with this, just to remind that, well, the last year was quite of an important year for us, for I think at all the people working in the field of antimicrobial resistance, as this General Assembly in the political declaration gives us also, there are a lot of commitment, and they give us, well, a kind of a duty, but also like the possibility, it's an opportunity to upscale the effort that we are actually contributing for. So there is no single country or sector that can respond to antimicrobial resistance alone. And I will say also not single the different research discipline. And with this, I close and thank you. And then I'm happy to take questions. Over to you, George.
Thank you very much, Francesca. You ended in a good point at the importance of collaborations, and that's one of the goals of these webinars. There's a reason why they are called dialogues, is to foster the dialogue between, in our case, international organizations, the UN, and other colleagues. So that's what we trigger, and leave time enough to the discussion and questions. And we have one comment and one question for now. In the chat, one colleague from Brazil, Marcelo Molento, is saying that he would like to share some of their data on antimicrobial resistance and antimicrobial resistance genes from water near pig farms in Brazil. This could be a collaborative work added to the FAO publication. I'm sure this is a welcome, and we have another division working on AMR research. But yeah, Francesca, we are in the same house, but I don't know if you have any comment to add to this one.
No, I think that I think that it's good. So I think that we will need to have a bilateral conversation to understand actually what it is there. But indeed, with this, we are looking for funds also to support for for supporting research. At the same time, like this document that I've been, well, let's say that has been the majority of my presentation, this One Health Priority Research Agenda, is also attracting donors. Maybe this is not through us, but at the country level. And we are also trying to actually try to have an understanding about what it is the research out there. So it is very welcome, like if you could like contact us, and then we can understand what it is more specifically on the data that you are gathering, because there is a lot of going on also, especially at the environment and then the agri-food surrounding of the environment. So
Indeed.
thank you very much, Marcelo, for sharing this.
Indeed. And yeah, your email is in the last slide, I believe. So you can follow up with us, with you directly, etc., and explore that collaboration. Another question, I think, refers to the numbers that we tend to refer to the Lancet publication. If you could please explain the difference in data regarding deaths associated to AMR and those attributed to it. For example, you have stated that in 2019, about 1.27 million deaths are as a result of AMR, and almost 5 million are associated with it. So if you could please clarify these two numbers.
Okay, yes. So basically there are there are differences like when they are reporting. So it is like, I would say, if you are an epidemiologist, what it is the case definition that you will use here. So there is usually, first of all, this publication, they only focus on bacterial antimicrobial resistance. So it is only like the one against antibiotics, so antibacterial actually. And there is a difference because in some cases they discuss about like, so associated and attributable. In one case, it is that they are, you can clearly attribute to the fact that the drug did not work. So, because so at the moment there is no TC, so there is no common case definition around that. So people can die for antimicrobial resistance because, for example, the drug did not work, and other can die because like it's already like the bacteria that it is a danger. So there is a difference between specifically attributable and associated. But let's say that is it's a way of like considering them the way in which they are defined. But you can find more information like on this publication, which is like for the data on 2021, but also the one for 2019. But yeah, things are evolving also because antimicrobial resistance per se, it is not a disease. So it's when it comes when there is like a failure, like because we have been using so much that they have the pathogen have developed the resistance.
Mm-hmm. Yeah, thank you for clarifying. Yeah, the number of deaths of AMR is a super important number for so many different reasons, but it's always debatable, no? Where it comes from, how you count them, and what you count, etc., etc. So
Yeah.
thank you for that.
Like, for example, there are many people that they are dying because they have surgical infection. But then, or like, people that go under heart surgery. So at the end, do they die because of the heart surgery or because like they got the infection after and then was not treatable? So.
Yeah. Good. A question that I think, point that I think always interesting, Francesca, I know that you have been collaborating a lot with the Global Research Hub, and the hub has this dashboard, and you mentioned it in your presentation. Can you please maybe, I don't know if all the colleagues, I find it super interesting, the information that that dashboard has. I don't know if you want to add a bit more, explain a bit more now that we have the time to say what information the colleagues can find in that dashboard and the information that the hub is collecting and putting out there. I find it super useful. I don't know if you want to
I
add
was
a
just
bit more
wondering
information.
yes. So, and we are actually collaborating with them, like also to make the dashboard to ensure that all the different research, especially for the One Health AMR research, are included. So indeed, so this is like it's a website, so you can easily access it. I don't know, like you can easily access. They do have different dashboards. So some of them, one of them is the one on the investment on the overall antimicrobial resistance. I was just wondering whether like would be easier if I just put the dash. I don't know. Can I do this like Jorge? Can I share like the
The
screen
screen,
with?
yeah.
Okay, I will share just like the screen with. Okay, can you see it?
Yeah, there you are. Yes.
So basically, there is this, you can easily find like on the web if you just Google it, the Global AMR Hub, and they do have a different dynamic dashboard. So they are now actually enlarging. So there are 3 different dashboards. One, it is on the investment of AMR research and development. This is actually the one that I was taking into consideration because it is a bit broad. There is also another one on clinical development and incentive for antibacterial research and development. And here you can find many different information. So of course, it is encouraged like, so whenever you have a project like to submit them because they are screening on a periodic ways. But I mean, if you submit it, then for sure, like the project is included, and you can actually play with the different with the dashboard. So first of all, for example, you can see here the information as as I was saying during the first half an hour, what is the total investment? You can also consider like the parameter, whether active or closed project. You can see how much it is the money that has been invested through the years. And well, don't be surprised that here it is less, because it is 2030. So like, funds can come. So it is very much consolidated on the first year. For the other one, it is as the information arrive. But it is a very good tool. Plus, you can have the information regarding the specific, like, toward what they are having a lot on bacteria and fungi, then also on the different areas that they are included. So they also categorize in the, let's say, the category of the type of the research which is done. And then this can also be explored a bit more into details, considering like the different sector. And this is just really in a nutshell. But you can, what I was putting you, it was, for example, the one on the different. You can get the information on the funders, the funding distribution. You just need to play. There is a lot of information. You can also download the information, like on the library. And we, as I was saying, that we are actually working as for the One Health Pride research agenda to ensure that also all the research topic of the 5 different pillars are also included.
Great. Thank you, Francesca. And I don't see any further questions in the chat. So I think we can conclude the discussion here. But as I said, Francesca has kindly shared her email address in the last slide, and the presentation will be shared in our channel. So you can always get in contact with us for that. Marina, our colleague taking care of the admin, already put there the feedback questionnaire on the chat, and we really appreciate some of the we really take into consideration what we listen from that. For example, the session used to be always on Tuesdays mornings, and now we have in Tuesdays and Thursdays, and we do it in the morning and afternoon. And many of the colleagues that are presenting came from the feedback form, suggesting to present their research data, for example, projects going on from low and middle income countries. So we are very welcome to share the work that we are doing. And as much as we can, we try to feature colleagues from different geographical areas and different projects and different areas of AMR. The AMR is the common denominator, but it can be social sciences, modeling, etc., etc. It's always interesting. But let me just see if I can share the upcoming slides. Yes, I hope it's there. So the upcoming, yes, National AMR Strategic Action in Animals in Thailand. So it's our colleague from Thailand that will be making the presentation on June 24. In the end, this will be the morning session, 9:30 to 10:30. And don't forget to send us the feedback questionnaire. And that's the email address, the overall email address of AMR here at FAO. So if you have anything to share with us, please do, and we'll address to the proper division or colleague. So thank you again, and I wish you all a good rest of the day. Thank you.